Hey guys, welcome back to my YouTube channel Knowledge is Power. Today I'm here with you all to discuss about one important procedure, that is nasogastric tube insertion. So without wasting much time, let us start with the topic. At last, after the discussion, I will also show the procedure with the help of video. Nasogastric tube. It is a tube that is passed through the nose and down through the nasopharynx and esophagus into the stomach. It can be used to remove the contents of the stomach, including air. It helps to decompress the stomach, helps in removing the gastric lavages, any kind of small objects, or hydrochloric acid. If it releases more, it helps in removing poisonous particles from the stomach. In case of suicidal cases, now let us know about the different indication where to use nasogastric tube. Nasogastric tube insertion is mostly commonly used for patients who are having neck or facial injuries, have had neck or facial surgery, the patient who needs mechanical ventilator to breathe, the person who is having any kind of obstruction, that is intestinal obstruction, or any kind of blockage. With the help of NG tube insertion, we can provide them food, nutrition. Now let us discuss about the different types of tubes. The tubes are of different sizes: short tubes, medium sized tubes, long tubes. Short tubes, it is passed through the nose into the stomach and it ranges from 14 to 18 fronts. Single lumen made of plastic or rubber with holes near the tip. Coming for the medium tubes, tubes are passed through the nose and passes to the duodenum and jejunum. Coming for the long tubes, it is passed through the nose, through the esophagus and stomach into the intestines, used for decompression of the intestines. Other indications for GI intubation includes it helps in decompressing the stomach, removing the gas and fluids particles from the stomach. It helps to remove ingested toxins that is released to the stomach. It helps to diagnose disorders of GI motility and other kind of disorders. It helps in administering medications and feeding to treat any kind of obstruction or blockage. Already I have discussed. To compress a bleeding site, to aspirate gastric contents for analysis, we can use GI intubation. Okay. Now let us know how to insert an NG tube. First of all, we need to assess the patient. Okay, we have to assess the surgical clients, we have to assess the ventilation status, we have to check whether the client is having any kind of impairment in neuromuscular function. The clients who are unable to maintain adequate oral intake to meet metabolic demands. So we have to assess all these things before inserting the NG tube. Afterwards, we need to assess the patency. We have to assess client's medical history. We have to ask the client whether he or she is having any kind of nose bleeding history, nasal surgery, whether he has done in his past history, then whether the client is having deviated nasal septum, or if the client is under anticoagulation therapy. We have to assess the client's gag reflex. We have to assess the mental status of the client, and most important thing, we have to assess the bowel sound. Next, we need to do proper planning before implementation. We have to collect all the required equipments. So all are the list of the articles that we required in order to insert NG tube. First is the 14 or 16 fronts gauge NG tube. Lubricating jelly is compulsory we need. Flashlight we need. emesis basin we need. Catheter tip syringe, 50 ml syringe, bowel with water and stethoscope. Now coming for the procedure, first and foremost we need to explain the entire procedure to the client. Positioning the client in a sitting or high Fowler position. Then we need to examine the feeding tube for any kind of abnormality. Then we have to determine the length of the tube that we are going to insert. Then we have to measure the distance from the tip of the nose to the earlobe. Then to the xiphoid process of the sternum. Afterwards, we need to prepare the NG tube for insertion process. Coming for the different risks of nasogastric insertion, NG tube feeding can also cause following disturbances to the patient like abdominal cramping, abdominal swelling. It can cause diarrhea, nausea, vomiting, and sometimes regurgitation of food or medicine can occur. Coming for the measurement, already I have explained, so have a look on this figure and you will understand it. The distance is from the earlobe to the tip of the nose and then to the xiphisternum. Now coming for the implementation, we need to wash hands, putting the gloves, lubricating the tube. Then we have to hand the client with a glass of water. Afterwards, we need to gently insert the tube through the nostril to back of throat, that is posterior nasopharynx area. Having the client flex head towards chest after tube has passed through the nasopharynx. This is the figure showing after the insertion of nasogastric tube. We have to emphasize the need to mouth breathe and we have to ask to swallow to the patient during the time of procedure. Swallowing helps the passes of the tube through the oropharynx. Advance tube each time client swallows until laser's length has been reached. Do not force the tube while insertion. Check the placement of the tube and X-ray is mandatory for the confirmation. And if the patient is complaining from aspiration, after the insertion of the tube, the following things are need to be observed. We need to observe the client to determine response during the time of procedure. We have to be alert. We have to assess the gagging. Prolonged intubation and stimulation of the gag reflex can result in vomiting and aspiration. Coughing, it may also lead to presence of tube in the airway. We have to note the following important points. After insertion of the tube, documentation is necessary. Size of the tube, which nostril and client's response. We have to record the length of the tube from the nostril to the end of the tube. Now coming for some responsibilities, we have to identify the signs and symptoms of any kind of respiratory complications. We have to identify the conditions that will increase the risk for spontaneous tube dislocation from the different positions. If the patient is suffering from vomiting, we can provide nasotracheal suctioning. We have to provide enteral nutrition. At last, I would like to show one demonstration how to perform NG tube insertion. As I have already mentioned, first of all we have to take the measurement from the tip of the nose to the earlobe and then to the xiphoid process. After that we will gently insert the tube into the nostrils. During the time of insertion, we will also advise the client to drink or take sip of water so that through this method the patient will swallow the NG tube and it will go into the right place. After the insertion of NG tube is completed, we will verify whether the tube has gone to the right place. So for that the confirmatory test is X-ray. Also we can hear with the help of stethoscope the whose sound as 10 to 30 ml of air is insufflated through the nasogastric tube. However, sounds may be transmitted to the epigastrium whether the tube is positioned to the lung, esophagus, duodenum or proximal jejunum. So with the help of stethoscope we can hear the sound. Mainly hissing sound is heard. Okay, this is all about the NG tube insertion. So for more such videos, please like, share and subscribe. If you like the video, please share among your friends and suggest me any topics you want to discuss along with me. And don't forget to give your valuable feedback down in the comment section below. So thank you.